Good morning. Today we are going to discuss on the topic periodontal flap surgery. So we will be discussing the topic under the following headings. First of all, we'll discuss the definition of periodontal flap. Then we will discuss the classification of flaps. Then what are the objectives of a flap surgery? Then indications and contraindications of flap surgery. What are the steps in flap surgery? And finally, we will conclude the topic. So what is the definition of a flap? Periodontal flap is a section of the gingiva or mucosa which is surgically separated from the underlying tissues to provide visibility and access to the bone and root surface. So in this picture, you can see it's a section of the gingiva and alveolar mucosa, and it is separated from the underlying tissues so that we can better visualize and access the bone and the root surface. Once you reflect the flap, you have direct access to the bone and root surface. So this is the definition, and you can see the keywords. It's a section, it's surgically separated, you will get visibility and access. So by combining these keywords, you will get the proper definition of a periodontal flap. So what are the objectives of doing a periodontal flap surgery? Periodontal flap surgery is one of the most commonly done surgical procedure in perio. So it's mainly done for pocket elimination. There is pocket therapy, and these are the objectives of periodontal flap surgery. You can easily remember the main objectives, which are all starting with R, the letter R. So for easy remembrance, you can remember it as it give access to root debridement. You can get access to the root surface so that you can properly debride the root surface. Then as you do root debridement, you will end up in reduction or elimination of the pocket. That is one of the objectives of periodontal flap surgery. You can reduce or even eliminate the pocket. Then when you get access to the bone surface, you can reshape the bone surface. Whenever there is irregularities in the bone surface as a result of periodontal disease, you can reshape the bone surface. Similarly, soft tissue, the gingiva also you can reshape. When you put incisions, you can reshape the soft tissue so that you can have a harmonious topography between the hard and soft tissue. So along with this, you can even try for regeneration of alveolar bone, periodontal ligament, and cementum. So in periodontal disease, what happens is loss of alveolar bone, periodontal ligament, and cementum. So when you do flap surgery, you can even try to regenerate the lost periodontal structures. So these are the objectives. Just remember the 4 objectives are starting with the letter R. Root debridement, reduction of pocket, reshaping of soft and hard tissues, as well as regeneration of periodontal structures. What are the indications of periodontal surgery? Periodontal flap surgery is mainly done to eliminate periodontal pocket. So it's mainly done for inaccessible pocket, and pocket become inaccessible when it become deep. Deep means more than 5 mm depth. Okay, so deep pockets you can go for a flap surgery. Similarly, in radiograph, when you see irregular bone surface or when you see a furcation involvement, you can proceed with a flap surgery. This is a furcation lesion. So in radiograph, you can see a radiolucency in the interradicular area. The furcation, the problem is again inaccessible area. It's very difficult to instrument with non-surgical approaches. So you may have to reflect a flap and do a proper debridement. Similarly, intrabony defect distal to the last molar. Distal to last molar means definitely it will be inaccessible. So when you have a pocket there, you can better reflect a flap and do the debridement. Similarly, usually it's done for deep pockets, but even if the pocket is moderate, when after repeatedly doing non-surgical therapy, if you cannot eliminate the inflammation completely, you can go for a flap surgery. So these are the indications mainly for pocket elimination in deep pockets. Deep means more than 5 mm pocket. Flap surgery is indicated. Similarly, irregular bony contour, deep crater and grade 2 or grade 3 furcation, and pocket distal to last molar, as well as persistent inflammation in moderate pockets. So whenever there is indication, definitely there will be contraindications as well. You cannot do flap surgery in every patient. You have to consider certain other factors. These factors are advanced stage. Suppose a patient with indications of flap surgery of the age 90 comes to your clinic. Can you go for a flap surgery? Is it advisable to go for a flap surgery? Better you can think about other non-surgical methods to maintain the dentition rather than subjecting an old individual for a surgical procedure. Okay. So even if there are indications, you have to consider the age of the patient. Similarly, systemic diseases, especially certain systemic diseases are contraindication for surgical procedure. Not all systemic diseases are contraindications. Only certain diseases are contraindications. For example, diabetes mellitus, when it's uncontrolled, it becomes a contraindication for periodontal surgery. So in that case, you have to go for controlling the diabetic status, and in the controlled patients, you can go for a periodontal flap surgery. Similarly, for a patient with malignancy who is under treatment, who is a patient with liver diseases, whose clotting factors are in varying level, patient with bleeding disorder, then cardiovascular disease, especially within 6 months after a heart attack or myocardial infarction, better not to subject the patient for a periodontal surgical procedure. Okay, there is another contraindication. The third contraindication, suppose you can remove all the subgingival deposits using a non-surgical approach, it's not advisable to go for a surgical procedure. Okay. So always think about the non-surgical approaches first. If you cannot manage the case with non-surgical approach, you can go for a surgical approach. Similarly, when patient motivation is inadequate, even if you do a flap surgery, if the patient is not maintaining properly, there is no use in subjecting the patient for a surgical procedure. Then in presence of infection, suppose you have given appointment for a surgical procedure, and on the day of a flap surgery, you are seeing that the patient is having an abscess in that particular site. So you can wait till the acute infection gets subsided and proceed with your surgical treatment rather than subjecting the patient for a surgical procedure with a periodontal abscess or an acute infection. And similarly, you have to evaluate the prognosis of that particular tooth, which is subjected to flap surgery before starting your treatment. If the prognosis is very poor and the tooth is inevitably going to be lost, it's unethical to subject the patient to a flap surgery. So these are the contraindications. So always when a patient comes to you, think about the indications as well as contraindications before planning for your surgical treatment. Next heading is classification of flaps. Periodontal flaps can be of different types based on different criteria. And these are the three criteria under which the flaps are classified. The first criteria is bone exposure after flap reflection. After reflect, so in the definition, we have seen that it's surgically, the flap is a section of gingiva or mucosa which is surgically separated from the underlying bone. So once you separate, whether you are exposing the bone or not, that is the first criteria. Second criteria, whether you are displacing the flap after surgery or keeping it in the same position. Third criteria is how you manage the interdental papilla. We can see one by one. So based on whether you are exposing the bone or not, it can be a full thickness flap where you see the bone directly. Okay. So you are reflecting the whole gingiva and the periosteum. That is called a full thickness flap or mucoperiosteal flap, and exposing the bone. This is called a full thickness flap. And the right side picture shows a partial thickness flap. So in this case, you can, in this diagrammatic representation, you can better appreciate. In full thickness flap, this is the gingival epithelium, this is the connective tissue, and the dark black area shows periosteum. So in full thickness, you are reflecting the epithelium, connective tissue, and periosteum from the bone surface, and you are exposing the bone surface. So this is a full thickness flap, otherwise called as a mucoperiosteal flap. It contains mucosa and periosteum. Whereas in split thickness or partial thickness flap, you are reflecting only the gingival epithelium and part of the connective tissue. And part of the connective tissue as well as periosteum is left over the bone surface. Okay. So this is called a partial thickness flap or mucosal flap. Here you cannot see the bone directly. Here bone is exposed. So this is based on bone exposure after surgery. The second classification is based on how you manage the flap after the surgery, whether you are keeping it in the same position and suturing or you are displacing the flap. So in this picture, you can see initially the flap was here, but after surgery, you are displacing the flap coronally and suturing. Okay. So this is a displaced flap. So in the first case, it's an undisplaced flap where you keep the flap in the same position or original position. And second case, you have displaced the flap coronally. So displacement can be in any direction. Need not be coronal always. You can even apically displace it or you can laterally displace it. So third classification of flap is based on how you manage the interdental papilla. You can split the interdental papilla into two, and one half will go with the buccal flap, other half will go with the palatal flap. This is a convention. This is how we routinely do the flap surgery. We just make a incision, splitting the papilla into two halves, one half along with the buccal flap and the other half with the palatal flap. But when you plan for a regenerative surgical procedure, suppose there is a bone defect here and you want to put some bone graft here, you can go for a papilla preservation flap. Okay. So the whole papilla can be taken with the buccal flap. And after placing the flap back to the original position and suturing, you can get a complete closure of the papilla area where you are placing the bone graft. Bone graft, above the bone graft, you are directly placing the papilla and it will have complete coverage. So in regenerative procedure, you can go for a papilla preservation flap rather than splitting the papilla into two. So that is about the different flap designs or classifications. Now moving on to the incisions, there can be horizontal incisions as well as vertical incisions. The most commonly done incisions are horizontal incisions. In flap surgery, you can have three types of incisions basically. The first incision is called internal bevel incision, and it's usually starting 0.5 to 1 millimeter from the gingival margin. Here you begin with the internal bevel incision. Okay. Follow the scalloping and internal bevel incision is put 0.5 to 1 millimeter from the gingival margin. Okay. From there, you are reflecting the flap. So in this picture also you can appreciate the internal bevel incision is this incision where you start the incision 0.5 to 1 millimeter from the gingival margin. Second incision is clavicular incision, which is made through the gingival crevice. See the blade angulation through the gingival crevice. Crevice is the space between the tooth and the gingiva, and through that crevice you are inserting the blade and putting the incision. This is a clavicular incision or second incision. Third incision is an interdental incision or made through the interdental area. There is a third incision. You can better appreciate these three incisions using the diagrammatic representation. The first incision, as I said before, it starts 0.5 to 1 millimeter from the gingival margin, okay, and it's directed towards the bone crest at a 45-degree angulation. This is a 45-degree angulation. When you keep the blade like this is 90-degree perpendicular. When you keep it straight, it's 0-degree parallel. So this is 45-degree in between 0-degree as well as 90-degree. So this is 45-degree angulation and you are aiming at the bone crest. Okay. Second incision is made through the crevice again till you feel the bone. So after putting internal bevel incision and the clavicular incision, you are getting a triangular wedge of tissue. And this tissue is removed with the help of third incision or interdental incision. So these are the horizontal incisions. Now, vertical incisions are not routinely given for flap surgery. You can give it if you want to displace the flap. That's mainly for displacing the flap. Okay. So if you want to displace it in any direction, apically or coronally, you can put the vertical. But when you put the vertical incision, you have to be very much careful about the position of vertical incision. You are not supposed to put it directly over the root surface or exactly in the middle of the interdental papilla. These two will compromise the blood supply. Okay, so it's advisable to put it in the line angle, either here so that you can include the papilla in the flap or here so that you can exclude the papilla. So this is the rule. When you put vertical incision, always put it in the line angle. Never put it exactly at the center of the root or at the center of the interdental papilla. So moving on to the steps in flap surgery. For any surgical procedure, initially you have to give local anesthesia, either infiltration or nerve block, depending on the site you are going to do the surgery. Okay, after attaining proper anesthesia, you can give incisions. We have already seen how the incisions are given, horizontal or vertical, depending on the technique you are going to perform. You can give incisions. After putting incisions, you can reflect the flap using periosteal elevator. Then you can directly see the bone surface and root surface. You will have better accessibility and visibility so that you can do proper debridement. That is the next step. Debriding the root surface and bone surface. All the granulation tissue, root deposits are removed and you are placing the flap back to either original position or in a displaced position depending on the type of flap, and you are doing suturing. This is the next step. And after suturing, you can give periodontal pack, but pack is optional. You can, if you want, you can give a periodontal pack. No pack also is acceptable. Usually pack is given to improve the comfort of the patient. So these are the steps in flap surgery. local anesthesia, incision, reflection, debridement, suturing, and periodontal pack. Now, we can see a video how the flap surgery is done. Here you can see the blade is inserted through the crevice and incisions are given. Okay, this is how the incisions are given. After incision, the flap is reflected. The black colored ones are root deposits. Okay, buccal as well as palatal, you have to give incisions. Now you remove all the granulation tissue, diseased tissue. And finally, the root deposits can be removed either using ultrasonic instruments, this is ultrasonic device, or using hand instrument, you can remove the deposits. This is a hand instrument, you can remove the deposits. Then finally, you can recontour the bone. This is a micromotor with a polishing burr. You can remove the bone irregularities as well as the root concavities and irrigate the area. Irrigate the area and finally you place the flap back and suture. And as I said before, you can either go for a periodontal pack or you can avoid a pack. It's optional. Then there are different flap surgical techniques depending on your objective. And the most commonly discussed ones are modified Whitman flap, apically repositioned flap, as well as undisplaced flap. And as I said before, if you are going for a regenerative procedure, you can go for a papilla preservation flap. So to conclude, periodontal flap surgery is one of the most commonly used surgical procedure, and it's mainly done to reduce deep pockets, periodontal pockets. And the diagnosis of a periodontal lesion is very critical. You have to find out the indications of surgery. If, see whether there are any contraindications for your surgical procedure. You should have a proper plan regarding the surgical procedure, how we are going to proceed with the surgery, what are the incisions that you are going to give, how you are reshaping the tissues, are you planning for a regenerative procedure? All these things should be in your mind before proceeding with your surgical treatment. Okay, so to recap, the things that we have discussed in today's class are the definition of a flap. We have seen that it's a section of the mucosa or gingiva which is surgically separated from the underlying tissues so that we will get better accessibility and visibility to the underlying tissues. Then we have seen the different indications and contraindications for periodontal surgery. Then objectives also we have mentioned. Then the types of flap, three classifications based on whether bone is exposed or not, whether the flap is displaced or not, and how you manage the papilla. We have seen the different types of flap, and we discussed about different incisions, horizontal as well as vertical incisions. Then steps in flap surgery also we discussed. And finally, I've seen the different surgical techniques. Okay, so that is in nutshell about periodontal flap surgical procedure, which is one of the very commonly done periodontal pocket elimination procedure. So thank you all.